In this tutorial, we're going to look at the limitations of the McKenzie exercises, with particular focus of the limitations when it comes to lower back pain and extension postures, or it could be known as the floppy push-up. And firstly, we're going to learn a little bit of anatomy. So we're going to learn about disc bulges because it particularly affects them. Then what we're going to do, once we understand a little bit more about the anatomy, we're then going to look at the exercises and understand why the exercises have limitations and aren't as effective as people think they are for lower back pain and disc bulges. Let's quickly look at what a disc bulge is. As you can see, we've got a normal disc here. So you've got disc annulus and then you've got nucleus pulpus. So the disc annulus is a fibrous wall that goes around the nucleus pulpus, which is a gel-like fluid in the middle. Now essentially a disc bulge is where the the pulpus, so the gel-like fluid, migrates its way through the wall, and then it migrates its way through the wall enough that the wall then starts to press on a nerve, and then that is when you'll experience the pain. Or if we go to a herniated disc, it goes all the way through the wall, breaches the wall, touches the nerve, and again gives you the pain on the nerve. So you may experience that as low back pain in the center of your back, or you may experience that as a sciatic type of pain going down the leg as well. As we start to move a little bit further towards talking about the exercises, the majority of disc bulges can shrink over a period of, say, 2 years, as well as the symptoms as well. Now, why does this happen? Well, material is reabsorbed. Now, this is going to be important when it comes to the exercises, so remember these bullet points here. So material is reabsorbed. Material becomes dehydrated. Macrophages digest the material. So if it's breached on the outside, your body will send little organisms in, and it will basically consume and digest the material that's on the outside of the wall, and then allow the material that's on the inside to move back further, and then allow that to heal across. And then the inflammatory response causes digestion of material. So as it inflames around the area, again, you will get that digestion of the material. So that's how it can heal itself. And what we're now going to talk about are the exercises and how they can align and speed this process up. So how do we help speed up this process of healing? Well, this is where the McKenzie approach comes in, and this is where I'm going to start talking about the floppy push-up. Now, as you can see in this diagram here, I'm doing a floppy push-up. My hips are on the floor, and I'm using my arms to push my chest up. Now, what this is creating, it's creating an exaggerated curve in my lower spine. Now, why this is important for the healing process? So first of all, we'll just talk about the mechanism, and then we're going to talk about the limitation of it. So if I say this is the back of my spine and this is the front of my spine. In the previous slide, we looked at a disc bulge and a disc herniation. So where the material is coming out the back of the disc. Now the back of the disc is here. So this is the back. So there would be some material sort of sticking out the back, albeit a bulge or a herniation. You've then got the nerve coming out and down, and then there would be touching here, and then it would be painful. So the idea of this exercise is when I go into the extension posture, I press down on the back, and then that drives the material back into the disc. So it's there to drive material forward, so forward into the disc, and create a vacuum. So it all sounds pretty sensible so far, and the mechanical sort of movement of the joint or of the spine is there, and it's going to help. But this is where the limitation comes in. This has been shown to work in people that have 70% disc height remaining. So we have to first use this, and it will become useful if they have 70% disc height remaining. So we have to understand that. We can't just prescribe that to everyone that comes in. We first have to understand, do they have a sensible amount of disc height. But there's also potential for the facet joints to damage due to the dynamic nature of the exercise. Now, I've drawn over this diagram unfortunately already, but basically you can see where, now this is called a spinous process and a spinous process, and then you've got a transverse process and a transverse process. They are basically, so if I just draw that here, so there's my disc again, I got the spinous process coming out the back, and I got two transverse processes coming out the side of the spine. Now, what can happen is in between each of these, there is a joint, and that is called the facet joint. Now, when I go into this extreme extension here of the spine, what you do is you press these two joints together and you compress them. And then what that can do, that can start to inflame and damage these joints. So we've started to pick up on some of the limitations where the mechanical movement represents a sensible idea for what we want to be doing with regards to a disc bulge. What we're starting to find now, if we start to put it into context and bring in some other structures of the spine, we start to find some limitations, so we have to start rethinking what we're going to do. So as I've mentioned, what is a facet joint? It's between two of the vertebrae, and it's in this area here, this area here. There will be another one here, and obviously another one here. So they'll be all the way up. And if I go into these extension postures, I put extra compression down onto them. So the repeated extension also increases the disc deterioration. So what we've understood now is that the mechanical movement makes sense. It drives material backwards, creates a vacuum, and helps speed up the healing process. But what we've got to understand is that there needs to be 70% disc height remaining, but also we are starting to damage the facet joints, and because of the dynamic nature of the movement, and the repeated extension also increases the disc deterioration. So what we're going to do in the next slide is look at what we can start doing instead. And that is essentially not to move the spine into as far an extension. So you can see again, you can see me here. I've got a little bit extra extension here, and all I've got is one fist. So my chin is on one fist, so that's just lifting my chest ever so slightly off the floor. And here I've got it on two fists, which is lifting my chest a little bit higher from the floor. So I've got a little bit of extension here and a little bit of extension here. Now, what's this doing? So static extension with fist under your chin. Well, this helps drive material forward in the disc. So the same mechanism as we were describing before, but it reduces further trauma on the facet joints. So we are reducing the stress on the facet joints because we are compressing them a lot less. So when it comes to just prescribing a floppy push-up or seeing it again on YouTube and someone saying you should do a floppy push-up because, you know, if you push down on the back, it will send it to the front, so on and so forth. We have to understand there are other mechanisms in place that we could be affecting. So what we need to be able to do is a much more sensible approach, which is don't put as much extension in the spine and just reduce the height at which the head and the chest comes off the floor. Now, I've got this information from Low Back Disorder, which is written by Stuart McGill. You can go and find the information in that book. There's a lot more good information in there as well. So I hope this tutorial has been helpful for you. Hopefully it's put into context the McKenzie floppy push-up. Hopefully it might have highlighted to you why your back is still hurting if you're doing it. And hopefully it's highlighted to you a better approach that you can start using that should improve or can improve your lower back pain. With all of that said, if these movements are still creating pain, then it's a useful idea not to do them. And if you want to find out more about what you can do instead, you can go to the link in the description and you can find out about my How to Overcome Lower Back Pain online course and online coaching. So many thanks for watching. My name is Chris from Chris for Whole Training. I'll speak to you in the next tutorial.